We're here this morning, or this afternoon, I guess, to talk about a lawsuit that we filed, this office filed with several of my Attorney General colleagues in federal district court here in Providence involving the termination, the unlawful termination of funding by the federal government, the Federal Department of Health and Human Services, more specifically the Centers for Disease Control and the Substance Abuse and Mental Health Administration, of millions of dollars of funds. In fact, $11 billion in funding to states, the plaintiff states, just the plaintiff states, which, by the way, includes only 23 or 24 of the states around the country. There are states that are not involved in this case where more funding is implicated. But for our states, the states involved in this case, we're talking about $11 billion in state funding, critical state funding for public health, coming from those two agencies that were terminated abruptly on March 24th. Again, we are convinced unlawfully. The impact on Rhode Island is $31 million. I think it's easy in the context of public health because, like most beings or species, we move on from challenges. We forget the impacts of things even as extraordinary and impactful as the COVID-19 pandemic. But if we take just a moment to think back and search our own memories for what that pandemic meant to us and our families, the impacts were extraordinary and challenged our health system in ways that I've never seen in my lifetime. So when I think about this funding, which was initially designed to expand, enhance, build our pandemic response capability, I have memories of the Washington Bridge with nobody on it. You know, today we worry about too much traffic. Back then there wasn't any traffic because people weren't going to work. They had lost their jobs. I was coming to work. I remember very vividly the absence of people on the highway, the absence of people in Providence. I remember getting my nose swabbed in parking garages in Providence, at Rhode Island Hospital, and at the train station in Wickford, so that I could come to work. Well, that work was being done by our very own Department of Health here, now led by Dr. Larkin, who's with me today. I remember being in Washington. I made a trip down there when we were still at the height of the pandemic to meet with my fellow attorneys general about the opioid cases that we had brought together. But I remember having a break from those meetings and going over to the mall. And at the time, there was, for lack of a better word, an exhibit on the mall which had a running total of people who had died from COVID. And deaths in the United States ultimately exceeded 1 million people. But at the time, there was an exhibit there that had a large square structure, for lack of a better word, where there was a running total of deaths from COVID. And every one of those deaths was represented by a small white flag planted on the mall by someone who had lost a loved one to COVID. And I remember going over, and I wasn't expecting to see it. I didn't know it was there. And I've been to Washington many, many times over the course of my career. And I remember going over and just bending down and looking at one of the flags, and it was a message from a grandchild to his grandfather, saying how much he loved his grandfather and how much he missed him. That was the very human toll of COVID. And it would have been far worse if we didn't have the kind of public health infrastructure that these funds were originally designed to build and maintain, and have been appropriated by Congress to continue to do that. And so that's what we're talking about here. COVID may be a memory, but if we bring that memory back, we all remember how that impacted our lives and cost lives of people in this country. It's the equivalent of wiping out the entire state of Rhode Island's population. And worldwide, it was much higher. And we're foolish if we think that kind of pandemic can't happen again. I mean, when I was growing up, the notion of, maybe this is true for all of you, I expect that it is, the notion that we could shut down our way of life for so long because of a pandemic was unthinkable. And yet it happened. And so we know today that the unthinkable happens and certainly can happen again. And so we need to be prepared. And these monies were appropriated by Congress to do that very thing. And so this case, if you go back up to 50,000, if you go up to 50,000 feet, is not dissimilar from the other cases that we have brought here in Rhode Island and around the country. The cases involving in Massachusetts that we filed involving National Institutes of Health funding. It's very similar. Congress appropriated the money, exercising its power of the purse. The president has attempted to stop it. The case that we filed here involving the Office of Management and Budget memorandum that stopped all kinds of funding for highway infrastructure and education and public health and more. We filed a case here in Rhode Island to stop the president's unlawful appropriation of that authority of Congress that he has taken on for himself. The complaint here, frankly, is very simple. And what it says is effectively is this, that Congress appropriated this money. It exercised its authority under the Constitution. The president has no right to change it through his agencies. When the Congress appropriates money, it is for the states to use, provided they remain in compliance with all of the conditions of the grant. And the cause here, stated by these agencies, sent on one day through some of the most arcane messaging that I've seen. I've read the terminations, and look, you have to be an expert in government funding to actually follow them. What they did in that one day on March 24th was to ignore the will of the Congress and ignore the Constitution. And all of this is consistent with what this president is doing. I've talked about this before. When he does what he does here, and that is to ignore the Congress's will. Remember, the Congress under our system of democracy has the power of the purse, not the president. The president's job is to execute the laws faithfully under the Constitution. The Congress's job is to, among other things, pass laws and appropriate funds, the power of the purse. The courts, of course, decide what the law is. It's that tension among our branches of government that preserves our freedom and our democracy. Well, when the president sidelines the Congress in this way, as he has done here, and as he has done in other instances, he takes the legislative authority unto himself. And when he undermines the courts in the way that he has, when he and the vice president and Mr. Musk and others talk about the courts as something that can be ignored if the court doesn't agree with what the president thinks the law is. When the president engages in that kind of action, what he has done is moved us to an authoritarian form of government. And so it's so important for purposes of our democracy that we fight back. But it's also important for purposes of ensuring that this $31 million and $11 billion nationally comes to the states as appropriated by Congress to do important work to keep us safe. Make no mistake, a pandemic is a matter of national security, and we have to be ready for the next one, and that's exactly what these funds are designed to do. They are designed to vaccinate children and older Rhode Islanders. They are designed to make sure that the new state laboratory functions will be up to state of the art. They will ensure that vaccines are stored and distributed properly. They will keep us safe. There is a reason why Rhode Island has not yet, and I hope this remains this way, has not been challenged by a significant measles outbreak, and that's because we have had significant vaccination uptake in Rhode Island, unlike in other places. And so it is this kind of public health work that keeps us safe. And there is no lawful basis for the president and the secretary of HHS, Mr. Kennedy, to pull these funds back when these states need them. And for Rhode Islanders who think that the public health interests don't matter to them, remember this. This work has to get done. And if these funds are not restored, that's $30 more million that the state has to find in its budget to do this work, because this work simply has to get done. And so the president, with one hand, giveth the $220 million for the bridge, and with this hand, he takes it away. And that is chaotic government. It is government by whim, and that's why attorneys general are fighting back as aggressively and frankly successfully as we are. I want to thank the staffs from the various offices. I have never seen better teamwork from offices around the country, from my co-leading states, particularly Colorado, in this case. You have to imagine 3 or 4 lawyers from each office, including this one here, working together around the clock to get these extraordinary filings on file in such a short amount of time. I want to thank Dr. Larkin and his team for giving us the ammunition we needed to file this case, because we have to translate for the court what this means to Rhode Islanders and what it means to the plaintiff states around the country. So it's been an extraordinary team effort by the attorneys general, more importantly by our staff, so I'm really grateful to them. We expect to have on file, if it's not on file already, the motion for a temporary restraining order. The complaint was filed this morning. That TRO will be on file shortly if it hasn't been filed already. And we anticipate a court hearing in this matter relatively soon. And with that, I will turn it over to Dr. Larkin to the extent he wants to share his thoughts with you, and then we'll be available for questions should you have any. Thank you very much for coming. Doctor?
I guess I will have to lower this. So thank you very much, General Neronha. So I want to focus my comments into 3 buckets, if you will. So what happened, what the consequences are, and what we are doing about it. But before that, I'd like to acknowledge and really thank the staff at the Department of Health, our legal staff, our programmatic leadership, our frontline staff in actually working very hard over the last week to help with this effort, the close coordination with the governor and the governor's office and with the Attorney General and his staff. So thank you to all of the participants in that. This is an example when government actually works to protect the interests of the people of Rhode Island. So what happened? So last week, we received notification that 4 critical grants were being terminated in mid-cycle, totaling an amount of $31 million of loss of grant funding from the CDC. These grants covered 4 different areas: vaccination, expanding laboratory capacity, addressing equity, and community health workers. What is the consequence of this? These grants, although they had their inception in the COVID pandemic, really rightly need to be understood as a response to the gaps and the damage done to the public health infrastructure from the pandemic. And this was a way of ensuring that when the next pandemic occurs, we have the capacity to respond to that appropriately, dynamically, and in good time. So loss of this funding endangers the people of Rhode Island. As my primary responsibility to ensure the well-being of the people of Rhode Island, it of course is incumbent upon myself and the Department of Health to act against this. So what are we doing? So over the last week, we have worked diligently to gather all the information about the implications of these grants and provide that to the governor's office and to the attorney general's office in order to take action to ensure that our people are safe. I'll close by giving a good example of how public health works. And the attorney general gave us all a vivid reminder of the pandemic related to COVID-19. But in January, we actually had a very vivid illustration of how public health works. So a person traveled from Rhode Island to a part of the world where measles is common, and that person was unvaccinated, not immune, and so acquired the infection. Measles is one of the most infectious, if not the most infectious, pathogen known to medical science. A person who is not immune, who comes into contact with someone with measles, has a 90% chance of acquiring the disease themselves. That person returned to Rhode Island. They exposed many people. However, their diagnosis was made in a timely fashion. Appropriate response was put in place by our healthcare providers, by the Department of Health. That person recovered. Nothing happened. What could have happened? If our vaccination rates had not been sufficient to ensure herd immunity, the concept that if enough people are immune, then a measles epidemic is not, or an epidemic is not propagated further, if our vaccination rates had not been high enough, I can assure everyone in this room and everyone in Rhode Island that we would be currently experiencing a measles epidemic similar to that which is occurring right now in Texas and New Mexico. As it happened, there were no secondary cases in Rhode Island. That is how public health works. So again, I'd like to close by thanking the staff of the Rhode Island Department of Health, the staff at the Governor's Office, and the staff of the Attorney General's Office in helping us with this very important response to these grant terminations. Thank you.
All right, questions, anybody?
Yeah, you talked about collaboration with about 24 others. Rhode Island, again, finds itself at the center of this one. I wanted to know how that comes about, how that decision is made to file here.
Yeah, so once we're aware of an issue, the attorneys general, we speak 3 times a week. It's scheduled, and we are now in the habit of talking that often, and our staffs talk every day. And so when the president takes an action like this one, we're ready. The question then becomes, well, who's going to work on this particular issue? The reason I mention my staff is I'm really grateful. I mean, the lawyering happens here. And, you know, if my staff was not capable of doing this work, we would not be able to participate in the way that we can. And I think it's important that we do. I think that's what leadership means. It means getting involved yourself with your team and making a significant contribution. Frankly, we weren't in a position to do that when I got here 7 years ago. So the way it works is this. We have a strong healthcare team here today. The work that team has done is extraordinary. And so when a health-related issue comes up, we are often first to put our hands up and say, look, we want to be involved in that. And then the question as to where to file a case becomes, you know, how quickly can we get the paperwork on file? What's that court's ability to handle a case of this magnitude and this significance? We think that is certainly the case here. Certainly because our team put their hand up and was one of the principal drafters, along with Colorado, with the pleadings here, along with Minnesota and our other co-lead states. We'll be ready to argue it here as we argue the OMB case. And so this is a case which had particular meaning to me because of my interest in healthcare, the difficulties that this state faces when it comes to healthcare. I think because of a lack of investment, this money is even more important that we preserve it. And so that's how that decision was made to bring this case here. There'll be others down the road, I think, but we are trying to file them in other states as well, depending on the circumstances and the bandwidth of those staffs to take those cases on.
So Dr. Larkin mentioned that this isn't just about COVID. It's efforts born out of the pandemic to fill in the gaps. But this was the statement from HHS last week on cutting the funding. The COVID-19 pandemic is over, and HHS will no longer waste billions of taxpayer dollars responding to a non-existent pandemic that Americans moved on from years ago.
Yeah.
What is your response to that? Does it confirm fears, criticism of Secretary Kennedy and his
of course. You know, for one thing, it's factually incorrect to say that it's the agency's decision as to whether these funds should continue to be allocated or not. That's the Congress's job, not the Secretary's. They're there to enforce the law and to spend the money as the Congress appropriated it. The president thinks all that power is his. It's not. If he wanted to have that kind of authority, he should have become a leader in a different country, not one that's a democracy. And that's true as it applies to him and as it applies to the secretary. So the fundamental legal problem is what he's doing directly contradicts what the Congress told the president to do, which is to spend this money. That's the deal. We pay our federal taxes in part to the federal government so that they can protect us from things that we can't protect ourselves from. We're not each going to have a military, and we're not going to do centralized disease planning from each state. It's coordinated by the federal government. And yet, there need to be boots on the ground here. Congress specifically appropriated, as we say in our complaint, after COVID-19 was declared over, to the extent that that in and of itself is a bit of a fallacy to the extent that we still get COVID-19 cases today. But the pandemic was declared over in 2023. But that doesn't mean we don't need to be planning for the next pandemic. And that's exactly what Congress did with respect to these funds. And planning means a lot of things. It's laboratory capacity. It's having the boots on the ground to distribute and store vaccines. It's the ability to get clinics out there to vaccinate children and older Rhode Islanders who may not get their vaccines as easily as people at different points in their lives. So the secretary and the president are dead wrong on this legally and as a matter of policy, and we're going to fight to preserve these funds for Rhode Islanders. It's not like it's optional, Brian. It's not like the state can just go ahead and say, well, we're not going to vaccinate children. Or we're going to lay all these people off, and we're not going to have to find that capacity somewhere. That's putting the state in a very difficult point of decision making. I don't draft the budget. That's for the governor and the General Assembly. But it's a $30 million hole in our budget that's not money that's wasted. It's money that's critical to public health.
What I was just going to clarify, Dr. Larkin, can the state do these efforts with less than $31 million, any portion of $31 million? And just to be clear, I know you talked about the efforts broadly, but without getting too much into the weeds, what does the money go to?
So to answer your first question, it's difficult to explain that which defies common sense to be explained. So the secretary's comments on their face make absolutely no sense. These grants were to build public health infrastructure for the next pandemic. They were not a direct response to the COVID-19 pandemic as understood the response of 2020, 2021, into 2022. Can the state do this work without the $31 million? That is 10% of the Department of Health's overall budget. It is 21% of our federal funding. These numbers are sort of similar across all 50 states. Maine lost $81 million. Massachusetts lost $87 million. Nationally, it was $11 million of withdrawal of support for public health across the country.
Billion.
11 billion. Did I say million?
Yes.
It was 11 billion with a B. Can the state do this work? Well, that ultimately will be up to the people of Rhode Island, their legislators, and government leaders such as myself, the Attorney General, the Governor. What would it mean to try and do this work? It would mean raising taxes. So the answer is yes, but the cost, which is taking our tax money and taking it away from Rhode Island to do God only knows what with it, build more Teslas, buy more Teslas, who knows?
And as part of the targeting of this seems to be about community organizations. A lot of those are BIPOC organizations that promote vaccines and help in different places, work in language areas that you might not be comfortable with. How is that affecting? I mean, that seems like a pretty big deal, and it seems also in line with the anti-DEI policies of the present administration as well. So how targeted do these attacks feel in those areas?
Well, I think they affect those areas, Steve. I mean, certainly we know that during COVID, some of the places that were the most difficult to get vaccines to were underserved communities. Right. And so a lot of the build out of our public health system was to serve those communities, as well as the broader public. And there may be some who say, well, who cares about those communities? I'm not one of those people, but look, I know how it works out there. Well, they're on their own. Well, the doctor, Dr. Larkin alluded to herd what?
Immunity.
Herd immunity. Herd immunity, which is what we heard all the time during COVID, right? When you get a certain percentage of the population vaccinated, that's how you end a pandemic. And so this is building out all of the infrastructure we need and maintaining the infrastructure we need to be ready for the next pandemic. I mean, how long did it take us to get to a point where we could be tested? Remember, in the beginning, there weren't enough masks. You couldn't get tested, right? Then, we built the infrastructure out, and you could get a test usually within 24 hours. The department was working around the clock to turn around that testing so that we knew whether we could go back to work or later go back to school. And so the notion that we don't need this infrastructure going forward because the pandemic was declared over, 2 years ago, and now we have a president and a secretary who doesn't care about public health in the same way as rational actors do. Well, I've said many times, this is a moment for attorneys general. This is what we do. We're lawyers. We know how to fight back. We know what the law requires. The Administrative Procedures Act, which is at the heart of this complaint, is about rational agency decision-making. And it's put in place by Congress to ensure that irrational decision-making doesn't happen. Well, this administration has been replete with irrational decision-making. This is just one context of it. So we're going to keep fighting every time the administration does something like this because, in this case, literally, the health and safety of Rhode Islanders depend on it. It's, in a long, long book, this is chapter 5 or 6. There are going to be many, many other chapters. Some will be filed here, and some will be filed in other places around the country. Other questions? Yes, sir.
Yeah, with everything kind of, in limbo now, I guess, until maybe the court grants your motion, have there been, legitimate pauses on that work? I don't know, or has the state stopped buying PPE for a stockpile, for instance, or anything
Yeah,
like that?
I can only speak nationally that I know that many of these funds were used for staff. And so this is going to have an impact on jobs in every state that we're talking about. I mean, in Minnesota, it's $220 million. In California, you're talking about millions of dollars, for, among other things, to keep LA County safe. We've got an international airport where a lot of people coming in from out of the country where, a lot of these diseases you could first land. So I think the initial impact will be in terms of jobs. So we hope to be in front of the court, within a matter of days. And if we are successful, as we have been in the past, then we will put this to a halt and we'll put the president back on his heels, which is what we've been able to do for the first couple of months of his administration. Feels like a lot longer, frankly.
I have a bit of a hypothetical for you.
Love those.
As we're seeing kind of increased sentiment on the right that a district judge shouldn't have more power than the president, do you still have faith that the administration would adhere to a ruling if the courts were to rule in your favor in this case? And
well,
if not, what then?
Well, look, we've had to file 2 motions to enforce in the case we filed here about a month and a half ago, and we just filed another pleading last night involving FEMA funding that has been turned off. And I anticipate a ruling in our favor on that matter as well. Look, this notion that district courts don't matter is the beginning of suggesting that appellate courts don't matter. And then ultimately, if the Supreme Court doesn't agree with the president, then the Supreme Court doesn't matter. And I think that's why we saw Chief Justice Roberts make the statement he made, I believe it was last week, about the need to respect the court process. I practiced in federal district court in Providence for about 15 years. The judges there are extraordinary jurists. Look, they know what the law is. We know what the law is. The law here is clear. The president doesn't care about the law. But by undermining the institutions, he moves us in an authoritarian direction because when we have 3 complementary branches of government and the president effectively sidelines or undermines 2 of the 3, there's only one left, and that's an authoritarian form of government. It sounds dramatic, I suspect, to some, but it's not hard to see if you're looking at it and analyzing it. The Congress decides where the money goes, not the president. That's not what he does, right? There's a process that he could follow to go back to the Congress. It's called rescission. He chooses not to use it. Why? Because he controls the Congress. His party controls the Congress, yet he doesn't use it. Why? Because he thinks it doesn't matter. He thinks he gets to decide. And so right now, the institutions and the rule of law, a phrase I often heard when Mr. Trump was president last time, now that rule of law has been able to hold. And I'm confident that it will continue to do so, because I think Americans fundamentally recognize that their democracy is important. You know, I was thinking about this today. We hear a lot, well, this is what the president was elected to do. Well, the fact that the president was elected by a majority of the people in this country, and a fairly bare majority, doesn't mean that the rest of us have to live in a country who didn't vote for him that no longer has our Constitution. The president still has to follow the law. The president does not operate beyond the law, above the law. He is not the law, as he said to Governor Janet Mills in the East Room some months ago. That's not who he is. He is the executive branch. His job is to faithfully execute the laws passed by Congress, including the budget. And at the end of the day, the people who decide what the law is are the federal judges and ultimately the Supreme Court. You don't like what Jack McConnell does here, for example, Judge McConnell more appropriately. You don't like what he does, well, you take it to the First Circuit. If you don't like what they do, then you go to the Supreme Court. That's the way it's worked for 250 years. We've done pretty well under those circumstances writ large. We're the greatest country in the world. There's no reason to change our institutions because of the ego of one man. And certainly, as long as I'm Attorney General, we're going to fight aggressively back against that kind of conduct.
Is this a sign that you're working better with the governor's office on these types of cases now? Because I noticed that you're here and you're answering to the governor.
Well, certainly we work with the, listen, my relationship with the governor, such as it is, will never get in the way of the work that we're doing. The fact of the matter is what I need from the governor's agency are the facts. I need them to tell me how they're implicated. I need them to put in writing how it's impacting them. And then I use those words to go to court. It's no different from when I use DEM testing to go to court to protect the Blackstone River. The governor's legal team are not sworn in as special assistant attorneys general to bring this case in court. So what they do is irrelevant to me. I don't really know what they're doing. But what I need from an agency perspective is I need the facts, because I can't get those. Once I have those facts, I'll put them in a lawsuit and I'll bring it. That's what's relevant to me, Steve.
Thanks.
You're welcome.
Dr. Larkin, with the Associated Press reporting layoffs at HHS already as of this morning, how does that affect your administration's ability to communicate with the greater powers that be, so to speak, and where do you see this moving forward? I know we're moving a little bit away from the funding loss.
It certainly doesn't make it easier, and we are still trying to understand all the implications, not just of the grant terminations, but all of these layoffs and what their overall plan is. So, so the answer is we do not know yet, other than it has been difficult since January 20th to communicate with any agency associated with this administration. I just want to answer the question about the targeting, if I may. Are the grant terminations targeted? Well, you'd have to ask the person who's doing the targeting to actually have the answer to that. Similar to, trying to explain that which cannot be explained. And I'll invoke common sense again. They certainly look targeted to me. I believe they are, but you'd have to actually ask the person who's doing the targeting as they are doing it.
Thank you.
What's that? Anything else? All right. Well, it's good to see you all.